Welcome to the Bougie Baldy Podcast with your host, Kelly Rhymes.
Society promotes beautiful long hair. They promote that as beauty. And because society promotes that as beauty, many women out here feel like if they don't have this long, beautiful hair, they're ugly. And that is far from the truth. Oh, I see you cut your hair. And I'm like, yeah. But then she's like, but don't you want to just leave a little bit of hair? Once again, did you ask me what was going on, why I cut my hair? And so out of respect, because she was an older lady, in my mind, I wanted to say, do you know me like that? Like, you don't know me like that, right?
Yeah. I just feel like we have reached a pinnacle in society where there is a lack of respect for people that are different than you. Yeah. And I think it becomes a broader conversation that we need to have because everybody is different and we all have the right to be different.
Yes. A lot of times when people approach us in a negative manner, it's because of a character defect or flaw that they have in their personality.
Mm-hmm. I think that us, along with the rest of the community, that we have some work to do because a lot of the questions and approaches that we get from folks who are not in the community is, I think, out of ignorance. And as baldies, I think we have the responsibility to start to educate and reach out more so that people can be aware and understand what's acceptable and what's not acceptable.
So I just left the office like, look, guess I'll just be wearing his wig. Didn't even know how to buy a wig at first. Looking a hot mess. Went to the beauty supply with my 60-some-year-old cousin and she wore a wig. And I'm like, I need help. And she's like, okay. We just trying to pick something out. It was a hot mess.
Yes, you don't think that bald women look good in a gown? Well, let me show you. Yes, we do. And we can still get glammed up and we still look classy and we still look beautiful.
But it was still very emotional when I first lost my hair and having to touch my head and see it in my hand and was just like, okay, this is very real.
She took my hand. She took my face on my hands and he said, honey, you are beautiful, but you're really losing corner here. She said, I suggest you find a wig that you like and go from there. And I left her office bawling, but I also felt so good because for the first time someone told me something that actually made sense to me.
Right now, I could grow my hair back out, but I love being bald, so I don't. So I still feel those questions of, so when are you gonna grow your hair back up? Are you growing your hair back out? No, I'm not, because like Denisha said, I was born to be bald.
Hey, welcome back to another episode of the Bougie Baldy Podcast. My name is Kelly. For those of you who are new, I am a women's hair loss support and authenticity coach, and I am here to support you with that emotional and mental challenges that you may be experiencing when you're going through your hair loss journey. I help take you from that insecure person to that confident person, and that is making a decision about how you choose to move forward with your hair loss, whether that's wearing a wig, it may be getting hair transplants, it may be shaving it off bald just like me. Whatever it is that makes you happy and that allows you to move forward in life, that is what I'm here to help you do. Now today I have another wonderful guest. Let me give you some information about her, okay? Today we are speaking with Kate Holohan, founder of Hair Therapy, has the qualifications, knowledge, and understanding that comes with over 2 decades of experience from working with the hair and scalp. With the background in hairdressing and education, her trichology clinic has been born from the obsession with anything involving hair and scalp health, being presented with 2 awards in less than a year of opening. Kate says, I have constantly been on a journey of learning and self-improvement through my life and my career, and has now naturally led me to a path of helping others. I can see how difficult and devastating hair loss and scalp problems can be. I am also trained in cutting and fitting wigs and working with those going through medical treatments such as chemotherapy. Kate has an in-depth understanding of the inner workings of the hair and scalp in order to nurture every client on their journey to achieving their optimum hair and scalp health so they can look and feel great. And that is what we all are striving for. Now,
Yeah.
Kate also believes that salons who do not have a trichologist or hair loss specialist within their business will be missing out on an untapped revenue and failing to help meet their clients' ever growing needs. This is why she has developed her own dedicated course, Hair and Scalp Salon Specialist, where she shares knowledge of the functions of the hair and scalp and aims to grow stylists' confidence and understanding when facing problems that they may be presented with in the salon. Welcome to the Bougie Body Podcast, Kate. How are you today?
Thank you. Yeah, I'm good. Thank you. It's nice to be here.
Now, as you all can hear from Kate's accent, she's in the UK. So, for anyone who is in the UK who's looking for some assistance with their hair loss, Kate is a person that you can go to and potentially help you with your challenges. So, Kate, let's go ahead and dive into everything about you, your business, and what you do. So, let's go with our first question. And you've built a impressive career spanning from education, therapeutic work, and now hair therapy. Can you take us back to the beginning and tell us what sparked your initial interest in working with people experiencing hair loss, and how did your teaching background prepare you for this unique specialization?
Yeah, definitely. So I got into the hair industry when I was 17.
Mhm.
So I've been doing hair for a long time. I've always had really creative background, artistic. I've loved that kind of element to it. But
Mhm.
as soon as I got qualified, I then got interested in learning how to educate. So not long after I had qualified and gained a little bit of experience and got comfortable with hairdressing, I wanted to do my assessor awards. So basically, I saw the trainees in the salon going to college and getting their work signed off. And I thought, well, if I can assess them in the salon, they're doing 10 times as much here daily as what they can do in one day at college. So we can really help them to progress their training and get through their qualification quicker and get more assessments done. So I started to do that, and I started to visit around other salons and assess for them. So I got to see lots of really good salons in London, like Errol Douglas, and it was really inspiring for me as well as being able to teach those
Okay.
students. So I've taught hair for a very long time, probably about 20 years.
Mhm.
And then probably maybe about 10 years ago, I became a member of the Fellowship of British Hairdressing. And when you're a member, you get to go on a lot of their courses and their education free of
Okay.
charge. And obviously, they've got some amazing members and people that teach for them and educate. And where I'd been in education for so long on the hair side, any technique that came out, you think when things like balayage first came out,
Mhm.
we had to be learning it straight away so that we could then offer courses in it. So my colour work, my cutting work, my styling work, I was always constantly having to keep that at the top of my game and keep an education with that.
Okay.
But I was then looking for education that I could do personally to kind of grow and expand. And
Mhm.
everything, the courses that were running was the same kind of things I was teaching.
Mhm.
So I then noticed that the Fellowship of British Hairdressing were running a hair health education evening. And I thought, you know what? Even after all this time teaching, hair health, hair loss, scalp health is something that I really don't know that much about.
Mhm.
So I went to this hair health evening, and it was hosted by Robert Eaton, who is an amazing hairdresser. He's won British Hairdresser of the Year at least twice.
Okay.
And I found out that also he was a trichologist. And even all this time in education and working with hair, I still didn't really even know what a trichologist was or what they did.
Mm-hmm.
And once him and his colleagues started explaining that they could help people with thinning hair, hair loss, scalp conditions, all this other stuff that we get faced with in the salon, we
Mm-hmm.
don't really have the answers for. And as soon as he kind of said, oh, look, I can help these people on this much deeper level, that was it. I was like on the train on the way home, emailing the Institute of Trichology in London saying, please sign me up for the next course. I definitely want to do this.
Okay.
So
And I think that's really important because I've said this before. Stylists are usually the first people to start seeing the thinning hair, the bald spots. They're in your head, in your hair, on a regular basis, and they can see the changes before you normally can. So I think it's always beneficial, like you said, to have someone, even if it's not that particular stylist, but someone in the salon who is a trichologist who can say, hey, can you come take a look at this person's hair or scalp and let me know what you're thinking and get some kind of advice so that that person who may be experiencing that hair loss can start going down the right direction and not just letting it continue to thin or come out or whatever may be happening with them. So I think that's very important, and kudos to you for taking that step.
well, let me tell you, I didn't know until I started the course how much I didn't know.
Hmm.
I found out a lot. It's a lot
Exactly.
of work.
It's always like that, right?
Yeah, but I loved it. It was really interesting. And obviously, I'm still learning now. So I've had my clinic open for 3 years now, and I still go to all the conferences every year.
Hmm.
Obviously, I have a podcast as well. So I get guests on my podcast and I learn from them as well. It's constant, you know, there's always more to know.
Exactly. And then things are changing, technology is changing. So you have to stay on top of what is new, what you may be able to learn to assist future clients and customers. So yeah, of course. Now, during that time, is that when I know you got your trichology, a registered trichology certification. Is it a
Yeah.
certification or is
Yeah.
it called, okay, so a certification. And then also you have another certification, the SRSH. Can you talk to us about what that is?
Yes. So following my certification in trichology, I was also approached by another education company called We Love Hair Salons,
Hmm.
who their whole kind of the ethos is they wanted a very, very high level of education available that was non-brand specific.
Okay.
So in the UK, you can do what's called like a colour master's degree, but
Hmm.
it's normally run by a product brand. So it might be Wella or Goldwell or L'Oreal, and you might
Hmm.
spend £3,000 doing a colour master's degree. But then if you go to another salon and they use a different product brand, it's not quite as relevant and it's a little
Right.
bit difficult to transfer that.
Hmm.
So although it's amazing that, especially as hairdressers, we can have that even higher level of knowledge, the lady that runs the course, Ray Palmer, she
Hmm.
wanted to include some trichology into this as well, so that it really was a little bit higher level knowledge and that people could expand their skills in all areas, not
Hmm.
just kind of colour or cutting or styling, although they do all that.
Okay.
So she asked me to teach for them as well to do some education. And with that, if you are part of her team, she basically encourages you very strongly to become a state registered hairdresser. So it may be
Okay.
that some of your listeners don't know that in the UK, you can open a hair salon with no qualifications whatsoever
Hmm.
legally. You may
Okay.
not get insurance, but people that tend to want to open a hair salon with no qualifications whatsoever probably don't really care whether they've got insurance or not, right?
Right. Right.
So it's really, really important that we try to maintain certain standards within the industry, and that as hairstylists, we have a responsibility to our clients to work safely, to make sure we have the relevant qualifications, to make sure that we have the insurance and that they're protected. And I
Okay.
think clients don't often know this. So they wouldn't even know to ask. You don't go into a salon and say, can I see your certificate? What level are you qualified to? Where's your liability insurance certificate? Is it valid?
Right.
Does it cover the service that you're going to provide for me? Especially now, so many more people are self employed or
Mm-hmm.
freelance. There's a huge responsibility on you as a cosmetologist or as a stylist to protect your client yourself. And being a state registered hairdresser is not a legal requirement in the UK, but it shows as a hairdresser to the clients that you are committed to that level of standard and that you would like, it's basically a movement for us to show that that's what we would like to happen.
Mm-hmm.
And it's quite important, really, but it just goes to show that the people that do that are normally invested in looking after their clients properly and being well educated.
Yeah, and you're right. I would never have thought, like, even if I had hair, anybody I know that goes to a stylist, that is not a thought. We automatically
Just
assume, okay, you have a
assume,
salon, so you must be qualified to do
yeah,
hair.
yeah. And
Especially if they, Mhm.
when I was younger, I looked very young. So I would always get clients go, oh, well, I don't mean to be rude, but how old are you?
Mm,
But they would never ask me, I mean, I could have come out of college the day before. They never said, do you have an MVQ in this? They were only worried about how old I was. And if I said, oh, I'm 24, they'd go,
mhm.
oh, okay, that's fine. And I felt like saying to them, but I've only been doing this a week, but I think you want that reassurance, but you wouldn't even know what to look for. And unfortunately, it's a little bit the same with trichology as well.
Mhm.
We get a lot of hair loss clinic franchise popping up and
Okay.
people that maybe do an online course or a 1 day course and then they start saying they're a trichologist, whereas again, I've got a full certification. I'm part of the kind of standards awarding body. I'm a registrant. I'm a registrant of the Institute of Trichology. So we have that code of conduct. We have those levels of practice that we have to adhere to. And there are people monitoring us to make sure that we're working safely and professionally and we're keeping up to date. So again, I think
Right.
it's really important.
Okay, okay. Now you've mentioned your business, your clinic. So let's talk about that a little bit more. So it is called Hair Therapy, correct? UK. Like,
Yeah.
okay. So you're doing some transformative work with people who are dealing with alopecia or cancer-related hair loss and other types of conditions. So what's one client story or a moment that really crystallized for you that this was your why, like why your work matters so much.
Well, it's quite funny because when you're a hairdresser in the salon, the aim really is to not make people cry.
Uh-huh.
And since I've been doing the clinic, I've had a lot more people cry, but it's normally tears of joy or tears
Right.
of relief, right?
Okay.
And I think most of my patients have kind of left and said that they feel much more reassured, they feel a lot more empowered, they feel a lot more like they know what's going on. I've had it's quite funny because some of the cases that have probably had the biggest impact on me and them are the ones
Hmm.
that you'd probably consider to be the least necessary, like people with dandruff,
Uh-huh.
um, or just people where there was one lady where she had chemotherapy induced alopecia. She'd
Hmm.
had chemotherapy, all her hair had fallen out, it had come back, but it wasn't quite how it used to be,
Okay.
but she had hair. So her friends and family kept saying, no, it's fine. You're making a fuss out of nothing.
Hmm.
You're imagining it. It's fine. You should be grateful you've even got hair. And she came to me and I looked at her and I said, you know what? It's not great. It's not the best quality hair. Your body still is obviously struggling. There are things we can do to help improve the density and the thickness and the quality of your hair going forwards. Gave her a lot of advice and a treatment. But the main thing was that she felt validated because she was like, see, I'm not imagining it. I'm not making it up.
Right.
Someone's actually telling me the truth. And I think even as hairstylists sometimes, or partners, I've got loads of patients that come into me and they go, oh, my husband it says it's fine and there's nothing to worry about and it still looks okay. But they're trying to do that to make them feel better, but in a way it kind of
Exactly.
makes you feel worse because you're
Hmm.
not being validated. And as far as I'm concerned, whether someone's losing 20% of their hair or 70% of their hair,
Hmm.
if it's a problem for them, then it's a problem.
It's a problem.
And I'm
Correct.
happy to discuss it with them. But one of the best ones I had is I've got a lady who has psoriasis over about 70% of her body.
Okay.
And it's a huge thing. She said when she goes swimming, people literally stare at her. She has it
Hmm.
all over her face, all over her hair and her scalp. And she actually developed a condition called pityriasis amiantaceae, where the scalp was so full of scale that it was starting to cause hair loss. It was starting to restrict her hair growth. And
Okay.
it meant her hair could barely move because it
Mm.
was so
It
kind of
was full of
clumped.
the dandruff.
Yeah, and it was
Okay.
so set on. And she'd really got to the point where she thought there was nothing that could be done about it.
Okay.
And she'd gone to see the doctor. The doctor had referred her to a dermatologist, and they said, we can offer you light therapy and it will
Hmm.
help your body, but it won't do your scalp.
Okay.
And she said, but that's the worst bit. That's the bit that's really affecting my confidence, my life, what I
Hmm.
do day to day, what I want to do. And she came to me, and within one treatment, we got about 80 to 90% of all the scale and build up off her scalp.
Okay.
And her
Good.
hair moved freely again. You know, you
Hmm.
could run your fingers through it. All the scale had kind of gone. It was an amazing result. And when you can do things like that, it's so satisfying.
Hmm. Hmm.
But I think, especially with a lot of scalp conditions, people try so many things and they don't work, or they work for a little while and then they kind of lose their effectiveness. And a lot of people, like even she said, she thought, well, this is just my life now. And she was a young, I think she was 34, had
Okay.
young children, had a load of life ahead of her, you know, wanted to be out, going swimming, doing stuff with her children, doing stuff with her partner, enjoying her
Hmm.
life, and it was really restricting her. And she honestly thought that that was the best it was going to be, and that was just going to be her next 60 years possibly.
Right. That was
And
it.
within one treatment we kind of turned that all around. So that was really amazing. Obviously I can't cure psoriasis, but we could
Right.
certainly get it to a point where it was well managed. She
Hmm.
knew what to do. You know, she had a lot more education around what's going to make this flare up and what's not. But
Hmm.
it's sometimes these, to someone that's never experienced it, you can't really understand how life-changing that kind of thing can be.
Yeah. Yeah. And so with this particular person, I know you said you got good results after the first treatment. But how many, like, does she have to, I'm sure she has to maintain over long term, because I know a friend of mine, a really good friend of mine, has psoriasis as well on her scalp, and she has to really take some measures to keep it under control, like making sure it's washed, every so often. And she has a deep, different techniques, deep conditioning and scrubs and different things. So what does she have to do to continue to maintain it so that it doesn't go back to what it was in the beginning?
Well, in an ideal world, obviously pityriasis amiantaceae, where it's built up a lot, that is where it's not been effectively managed. So in an ideal world, we did do another treatment a month later because, like I say, there was still a little bit of scale there. It needed a little bit more.
Okay.
But the treatments that I do involve keratolytic creams. So it's a
Hmm.
juniper, salicylic acid, and steam as well. So everything is very gently softened and dissolved. There's no scraping, there's no scratching, there's no scrubbing, there's no damage to the scalp. And that was also part of her problem. Where you have skin cells compounding on the scalp, the oil gets absorbed, it all gets very moist. You get a lot of bacteria and microbes that you don't want, and then it becomes very itchy. So part of the problem is that itch scratch cycle where you sit and you scratch, you damage the scalp. The
Right.
scalp then gets sore because you've damaged it, you're then scratching it more. So part of it is to break that cycle. So I have some amazing trichological products,
Okay.
And I do them in the clinic, but I also do sell them as well on the website. And I sell the scalp creams so that people can maintain it at home if they need a proper treatment. So, like you would do a hair mask on the hair, you can do a scalp mask on the scalp. But again, that will soften and dissolve that scale off. So, you're not tempted to then scrape it off or scrub it or scratch it and damage the scalp. I
Okay.
also have a soothing scalp lotion. So what I generally tend to say to people if it's very itchy is, if you're going to scratch, stop. Get the scalp lotion and spray that on instead to soothe it.
Okay.
So even after even after the first treatment she'd done with me, when she came back, the scale, some of it had returned, but the damage underneath and the redness and the excoriation was gone because
Okay.
she also took a shampoo, the Juniper shampoo, which is amazing. She took that home with her as well, and that removes itchiness. But also the products are anti-mitotic. So the
Okay.
one real benefit that I have, a lot of anti-dandruff shampoos, they remove the scale, but they also remove all the microbiome of the scalp, all the beneficial elements to the scalp. And although they remove that scale, they don't stop it from coming back. So it's like shoveling a driveway while it's still snowing, right?
Yep.
Which, if you've had psoriasis or dandruff, you probably understand that metaphor because you've probably been there.
Right.
So you need something that is antipruritic, antimitotic, and antimicrobic. Yeah.
Oh.
So it's going to reduce the amount of bad pathogens on the scalp. It's also going to reduce the itching, but it's also going to reduce your skin cell production back down to a more normal rate so that the scale takes longer to develop. So it's kind of it's a combination of everything, not just, oh, we will clear it all off. We're actually helping to promote better scalp health and reduce that scale coming back as well. So it's a bit of a long-term thing, but you can certainly get to a point where it's happening less.
Okay.
But then also, you then have that external element. So, for example, with this lady, she was intolerant to dairy, but she admitted to me that sometimes she would still have it. She was also smoking.
Okay.
So we did have a discussion about that, but she did inform me that she had very high stress levels and that committing murder was probably worse than smoking. So we had to kind of find that balance. As of yet, she was not willing to quit the smoking, but she did understand that, you know, anything like that with some people, especially with things like eczema, seborrheic dermatitis, they know that if they eat certain foods, like very, very high sugar foods, very over processed foods, even alcohol, that can flare their condition up. So we do have to take a very multifaceted approach to really get on top of it.
Okay.
And we also have to work with the client about what's actually realistic for them to do. But you can certainly get to a level where it's much better managed. And I think also anything like that, scalp problems, hair loss, eventually you can build that relationship with them because what's really happening is your body's not happy and it's trying to tell you, right? That there's
It's responding, yeah.
something there that your body's out of balance with and it's not happy with. And eventually you can use that as a kind of an early warning sign to say, oh, my scalp's flaring up a little bit. Maybe I've not been sleeping well enough.Maybe I have been a bit stressed. Maybe I do need to go back and do a bit more yoga or meditation or do a bit more mindfulness or what shifted that I know that I can take better control of, you know?
Control of it. Yeah.
And
Yeah.
that can be quite a useful tool eventually if you start to learn to work with it, but it takes quite a while to get to that point.
Okay. Got it. Got it. So we've been talking about Hair Therapy UK. So let's talk about what it offers. What range of services you provide from, I know you do consultations that are bespoke for hair systems, correct? Okay.
Yeah.
So can you break down like your process, what you offer, what a client typically goes through with their journey, during their journey with you guys and working with them?
Yeah, definitely. So This is one of the main services, and one of the first things you would do if you came to see me is to probably have a clinical consultation, which is a full hour appointment. And that mainly is for a diagnosis, complete history. We'll investigate all aspects of what's going on. We look at your diet, your nutrition, your lifestyle, your kind of health levels, every single aspect. And a lot of the times people are quite surprised about what, they're like, well, why are you asking that? What's my diet got to do with my hair health? So again, you do kind of get a little bit of an education into which factors actually might affect hair loss and why. But we really do use that time to investigate what's going on. And I think that's one of the key main things is, again, especially in the UK, you go and see a doctor, they're not actually specialists in hair loss. So they do have limited knowledge, especially in the most common conditions that we're seeing at the moment. We're getting a lot of people that are losing a lot of hair from things like weight loss drugs, menopause. There's lots of different factors that your GP might have some knowledge on, but not a huge amount. And they also generally tend to have 10 minutes.
Okay. Yeah, you're right. You're rushed.
You don't get that whole. So one of the main things is that people say you're the first person that's actually listened to me. Right? It's a very, very safe space. My clinic is very discreet. It's one-on-one. You're not having to walk through a busy salon with everyone else getting all their hair done while you're kind of like, oh my God, I really feel embarrassed. So then again, it would be kind of looking at all those factors that I said. We do a full consultation, or I take photographs as well. I will look at any data, so any medication someone's taking, any supplements, any blood tests they've got. If they don't have blood tests, we can kind of discover what blood tests might be useful so that we've got some measurable data. We can look at things like, do we need to supplement? What treatments could we offer? So there's loads of different treatments that we could offer. It could be products. It could be in-clinic treatments. I do UV, infrared, steam, massage, keratolytics. I even do microneedling and exosomes treatments as well. We can look at pharmaceutical options, things like minoxidil, finasteride, the usual products. If someone's having chemotherapy, I can guide them through things like scalp cooling, supplementation, and again, what to do afterwards. Can you colour your hair? When can you colour your hair? What should you use? Do you want to wig in the meantime? Or even things like toppers can really help. Obviously, for men, I do offer the hair systems as well, which can be it can make an amazing difference to people. So I've got lots of different options to make sure that when you come, I'm tailoring it to you rather than me saying, well, I've only got this type of wig, so it's that or nothing. Or, well, I only offer, unfortunately, a lot of the time when you go to the doctor, they want to give you that prescription so they can tick that box and go, right, you're done. Right. So the doctors will often recommend things like minoxidil, even when it's not really suitable or it's not the best answer. And there's quite a few people that want a more holistic approach, or they want to try something a bit more natural first.
Right.
It shouldn't be, let's go straight to the drug that you're going to have to take or administer every day for life, for as long as you want hair.
Let's pay out of your pocket.
Right. Let's look at what we could do in other options. And also, the drugs all come with side effects. And so I also get people that have tried, like a lot of men, for a very young man experiencing hair loss, they get put on a medication that could cause erectile dysfunction, low libido, even suicidal thoughts, depressive moods, loss of confidence. If you're looking at someone who's 24 years old, that is not a suitable lifetime treatment regime for that person. It's not going to work. And actually for finasteride especially, you can suffer something called post-finasteride syndrome,
Mm-hmm.
where a bit like long COVID, where even after you stop taking it, there's no
Uh-huh.
guarantee that those symptoms will go away.
Oh, really? Okay.
Yeah.
Okay.
So it's all this kind of thing that we discuss with people to really make sure. I'm not against medication by any means, but it needs to be the right choice for that person, and they
Mm-hmm.
need to have all that knowledge and education first to make that choice.
Yes, yes. Now, I know here in the United States, trichologists aren't allowed to prescribe any medications. Is that the same in the UK?
Yeah,
Okay,
yeah,
okay. But you can advise them on the medications and what they
yeah,
do, how it would affect them based
yeah,
off of the tests and things you've run. So,
absolutely.
um, I've been talking to, quite a few people who specialize in hair loss in various different ways, and I am hearing more and more often that they are doing these tests and running DNA things and just doing more internal, looking
Yeah,
more internally to figure out what is really going on, what is the real root cause of what's happening here. And I think
yeah,
that is awesome, that holistic approach. You are correct. So when I lead a support group for the Scarring Alopecia Foundation here in the States. And a lot of women, I'm hearing more and more, I don't want to do the medicine anymore. I don't want to have these side effects. I want something more holistic. Some of them have even taken themselves off the medication, stopped going to the dermatologist, and have tried to just figure out what natural products work for them and have seen some
yeah,
results.
yeah,
So there are a lot of different options, but to your point, everyone is different. So you may need a different kind of treatment plan versus the next person. And I've said that so many times on this podcast, but I like to hone in on that because it's so
yes.
important.
Yes. But again, I've got so this DHT blockers, finasteride, dutasteride, Propecia, they're not the
Hmm.
only option. I have a natural DHT blocker tablet. I have
Okay.
a DHT blocker scalp application cream. So there are, even if you want the same kind of product, there are different options that your GP won't have any knowledge of, or that you may not know if you're just looking on Amazon or whatever.
Hmm.
Um, and again with things like minoxidil, I have an amazing scalp treatment spray called Trichoactive Plus, which has a lot of the same properties and abilities as minoxidil. It also has DHT blockers in it, and it has vasodilator properties as well. So it actually does about 5 things, and it's 96% natural.
Okay. Oh,
And you
yeah.
can use that every day, and people do get amazing results with it.
Hmm.
But if you stop using it or you don't use it every single day, you're not going to have the fallout that you do with something like minoxidil, where
Okay.
suddenly all that hair that you've retained suddenly disappears. So
Hmm.
there are more options, I think, than people realise as well. And I think that's why it is good to see a specialist, because although some medications are prescription only,
Hmm.
minoxidil, you can buy that off Amazon.
Right.
So,
Right.
and I think when people get really desperate, or even a lot of magazine articles or on TikTok, it gets thrown around like it's
Hmm.
nothing.
Hmm.
And I just think, like you say, to see that specialist that can really say for you what is going to be the best, or have a little bit of a treatment plan,
Right.
because it's always there further down the line if you try the other natural options and you don't like them. But
Hmm.
especially with something like scarring alopecia, I'm sure you've seen this many times
Hmm.
with something like CCCA, which I know that you do a lot of work on.
Yep. Hmm.
Often the patient is often told, well, it's your bad hairdressing practices, or it's chemical use, or you've done this to yourself. It's often
Yes.
misdiagnosed, or they get blamed. They don't get the help they need, and it's
Hmm.
not recognised. Or, like in my case recently, I had a patient who'd been to the doctor. She'd not really had any help from him, came to me. I wrote a letter to her GP with the diagnosis and my findings and my recommendations for treatment. He
Hmm.
referred her to a dermatologist on the NHS, and the dermatologist said to her that her condition wasn't severe enough to qualify for treatment.
What?
Now, the problem with that is it's a scarring, progressive condition.
Yes.
So by the
Yes.
time her condition is severe enough to qualify for treatment, there won't be any hair left to treat,
Right. The
right?
follicles are gone. Yes.
So time is follicles. We all know this. And the sooner that you can get that help, whatever it is, or you can try something and you can get to work on that, you could prevent further hair loss, further damage,
Mm-hmm.
and retain the hair that you've got. So it's really important to kind of have those solutions. And like I say, if you Google it, I mean, nowadays everyone's just asking ChatGPT. Well, that's great, but ChatGPT's never met you. So they're going off
Exactly.
all this information off the internet. Some of it's valid, some of it's not.
Mm-hmm.
It doesn't know what it's sifting through. It's going to give you some kind of answer, but it's no match for someone being there, physically looking,
Mm-hmm.
measuring things, looking with a trichoscope, looking at the hair follicles, and really understanding what's going on with you specifically.
Right, right. So I know like you mentioned this earlier that you are an educator as well
Yes.
as trichologist and stylist, all of the things. But what are some of the misconceptions? You mentioned how people try to, use different products like the minoxidil on their own and this and that. So, but what is some of the misconceptions about hair loss or hair replacement that you find constantly correcting?
Well, I do think that it's very important if you're going to do something like have a hair replacement system, so like a hair system or a mesh integration system or something like that, that
Mm-hmm.
you definitely need to make sure that before you kind of go anywhere down that route, that you have had a diagnosis and you do know what type of hair loss you've got. Because I think
Right.
this is the other problem. Like I said earlier, you get a lot of hair loss specialists where actually all they've learned is how to fit hair systems or how
Mm-hmm.
to sell certain treatments or products. There's a lot of franchises
Mm-hmm.
where you actually look on their website, it doesn't mention the word trichologist. It will just say, oh, hair loss specialist. So they're not
Okay.
actually qualified or educated to the same level. And for example, I had a guy come in with male pattern hair loss.
Uh-huh.
And like a lot of men with male pattern hair loss, he had seborrheic dermatitis as well.
Mm-hmm.
And his hair loss wasn't even that bad. You could see his scalp on the top, but it wasn't kind of, full on baldness gone past the point of no return.
Okay.
We could treat his hair and probably increase the density and the thickness, get a little bit more back and make it look reasonable.
Mm-hmm.
But also he had seborrheic dermatitis, so he's got a very irritant scaling scalp condition. And he said, oh, my barber's always saying to me, oh, we'll just shave it off and put a hair system on. I said, how can you do that when you've got this scalp condition?
Yeah,
And
that's
he said,
going
oh,
to
I
get worse.
know. But if you just learnt the almost like the band-aid,
Mm-hmm.
and you've never kind of looked at the causative factors. So I think that level of education's massively important. So even if you've decided or that your hair loss can't be cured or made better, make sure
Mm-hmm.
that you're going to someone with that knowledge and education as well as the skills to do what you want, especially again things like PRP, microneedling.
Right.
You can't just go to a beauty therapist that has no concept of hair loss. And I've
Mm-hmm.
seen it myself where people put things up on Instagram going, this will cure your hair loss. And I'm like, you can't, how can you possibly promise that
Yeah,
to
exactly.
anyone? So it's really important to know what's going on first.
Mm-hmm.
And again, the amount of times I see in Facebook groups where people say, oh, my client's got this problem, or my mum's got this problem, or oh, I've got hair loss, and someone will say, oh, I've got hormonal hair loss, how do I fix it? And someone else say, oh, take these supplements, or take collagen, or do this, or do that.
Right.
And I'm like, well, if the issue's hormones or stress, how are vitamins going to help that?
Right. You got to
So
reduce
we get,
stress and
yeah,
replace the
find a
hormones or whatever.
strategy, right?
Right, balance it
So,
out.
but so it's really just to be aware that there's a lot of industries out there and a lot of product companies and a lot of people that know that they can capitalize on your frustration, your desperation,
Yep.
and the fact that people will do anything when they're in that state of not having any control. So
Mm-hmm.
for me, that's why it's really important. Go and see someone early. Don't think, oh, I'm making a fuss about nothing. Oh, it's not that bad. It doesn't matter. Go and see someone and get that advice and get that knowledge and understanding, because then if you want a certain treatment, you can have that. But
Mm-hmm.
it's making sure you know what's going on first and not listening. Someone will put a photo up on Facebook and people will go, oh, that's FFA, that's telogen effluvium, that's female pattern hair loss, oh, that's alopecia, that's caused by DHT. Well, not necessarily. What if it's an autoimmune condition?
Mm.
How is that going to
Right.
be helped by supplements or by rosemary oil or, something else? So
Mhm.
I've heard so many, fixes and so many things. People go, oh, do this, do that. And I think, oh, please don't. So when you're trying to take that advice from these lovely, well-meaning people, just remember that there are specialists out there that actually have up-to-date knowledge and education that could probably advise you better.
Yes. And that's what I try to encourage people in the audience to go see specialists, okay? Because those are the people who will really be able to be honest with you and tell you the truth and actually assist you if they can assist you. They're going to be honest with you. Now, your work, it sits between like the intersections of medical knowledge, aesthetics, mental health. Like you are kind of in that world
Yeah,
supporting all of that, right?
yeah.
So how do you really define success with your clients? And I guess I guess I should say it like this. How do you define success with your clients? And is it about the hair, their confidence, or is it more just in anything else in entirely? Like what is
Well,
the definition?
I think even as hairdressers, we all know that we are kind of unofficial counsellors, right? We get
True.
told everything about our clients. We get told that they're pregnant before they've even told their partner, or we get told they're going to leave their partner before their partner even knows it's happening. I've been told about credit card debt, all sorts of stuff. It's amazing. And we
Mhm.
are there to support them. And like I said earlier, from a trichologist point of view, we can just take that to a whole nother level.
Mhm.
So and again, on my podcast, I've even had people come on my podcast who have said to me they've never spoken to anyone about their hair loss. Their partner's
Mhm.
never seen it. They've never spoken to their friends or family. So I
Mhm.
think one of the things is to really make people aware that no matter what they're going through, they're not alone. There are other people going through it. There are people out there who know exactly how you feel, who have
Right.
been where you have been, and hopefully can tell you that there is light at the end of the tunnel and there is a better place to get to. But
Mhm.
ultimately, I say to a lot of my patients, unfortunately, the success for me is I never see them again,
Oh, well,
right?
yeah.
They
Yeah.
don't need me anymore,
Problem
which is quite
solved.
sad. But it does happen. It's not going to happen for everyone. Some patients I have that they come back to me, even if it's every 6 months, we might do a microneedling top up
Okay.
or, do an assessment, see where they're at, see if everything they're doing is working.
Mm-hmm.
But ideally, I can help someone so much that they've got all the knowledge and the products and, the treatment that they can be okay on their own, but also they know the door's always open for me if they need me.
If they
But
need you. Yeah.
I think the main thing is, like we've already said, is that they finally get a diagnosis, they understand what's going on. They've got, I'd rather give someone all that knowledge so they can be empowered and they can advocate for themselves. It's not about me telling them
Mm-hmm.
what to do or making them, ruling them and telling them, well, you've got to do this, this, and this. It's
Mm-hmm.
about empowering them enough with the knowledge so that they don't think, oh, well, this is just going to be my life forever. They've actually got options and they know what they can do going forward. And I think that's really
Right.
important. But also having those really, really good quality, trichological grade, science backed products that work
Mm-hmm.
takes a lot of the guesswork out of it.
Yes. Okay. Okay. Now, let's talk about some future projects or projects you're currently working on that you want to tell the audience. So, what are some exciting projects or developments that are on the horizon with Hair Therapy UK? Or any new services, partnerships, anything you want to talk about? Go ahead and share that with the audience.
So 2025 was actually an amazing year for me. I did more speaking in 2025 than I think I've done for a good few years, including internationally.
Okay, good.
So that was amazing. I did a talk at the World Trichology Conference in New York in
Mm-hmm.
August. So I loved that so much. And all the peers that were there were really supportive and they were really like enjoyed it and were really positive. So I definitely would like to do some more international speaking.
Okay.
I've got the Kent Health and Wellness Festival in July in the UK, which I will be doing a talk at again this year on how to achieve optimum hair and scalp health.
Okay.
We've kind of briefly said, I also do a 1 day. Well, I've got a few different courses now because it's kind of grown a little bit. But
Okay.
the main course that I do is called the Hair and Scalp Salon Specialist, and it's a 1 day online course. So
Mm-hmm.
that's designed for hairdressers or people in the industry that do want that little bit of confidence, that little bit of knowledge and education around the types of hair loss and scalp problems that clients will come in with.
Okay.
So for some stylists, they might not even mention to their client,
Mm-hmm.
oh, I see that you're losing hair or you've got this scalp problem because they think, well, if I say something, they're going to ask me what to do about it.
Right. And they
And I
don't know what
don't
to
know.
tell them.
So I'm just not, or I don't want to upset them. So
Right.
I'm going to be doing that every month. I do an online course and I do face to face as well. But off
Okay.
the back of that, I've also been running a scalp treatment workshop. So teaching other trichologists and people in the hair industry how to do scalp treatments and the hair loss
Mhm.
treatments that I do and the scalp treatments that I do. Now, the
Okay.
products that I use are from a company called UK Hair Specialists,
Mm-hmm.
which is owned by Eva Proudman. So from January 2026, I am going to be partnering with her and doing some education for her. So we're hoping to expand all the products into a lot more clinics, into barbershops, salons, so that they are more accessible and to
Okay.
educate people on that. So I'm going to be doing a lot of education. Hopefully, the podcast will still be running. I've
Okay.
got a lot of good guests lined up for that as well. So we're going to be a lot more education, a lot more in-person, hands-on education as well, which I love.
Okay.
I've got the World Trichology Conference in Paris as well in July, which I'm definitely going to go to.
Okay.
Nice and
Okay.
easy for me. I can literally get the train, so that's going to be
Yes.
amazing.
Uh-huh.
I'm excited to see what else comes up. I'm sure, ask me in 6 months' time, I'll probably have something else lined up. But
I'm sure.
I've just been so kind of loving everything that I've been doing, and I've
Mm-hmm.
had such great feedback from it that I'm just kind of riding that wave still at the moment and want to continue that for the whole of the year, really.
Okay. Okay. So if anyone out there in the audience wants to get in contact with you, take a look at your work or your services or anything like that, what are the best ways to reach out to you?
Yeah, so the website is hairtherapyuk.com. Or you can look on Instagram, Hair Therapy UK is probably the best one.
Okay.
For anyone who is struggling with hair loss, or if they want to learn more about, I have lots on my podcast of really good guests. So I do real life stories, but I also have really good guests. So we talk about different treatments, different
Mm-hmm.
conditions, anything like that. So I've got an amazing resource library there for people. So if people want to learn about any condition, treatment, medication, it should be on there.
Okay.
If it's not, let me know and I can do an episode on it. So the hair therapy podcast is available on all platforms as well. So that can be really good. If you're not sick of my voice already, there's about 200 episodes on there that you can delve into and pick and choose the ones that you might be relevant to you as well. But my DMs on Instagram are always open. That's where I hang out the most. I'm on everything,
Okay.
but that's really where I hang out the most because I like a visual post rather than a
So
typing.
tell everybody what platforms your podcast is on so they can make sure they can go listen and all of that.
So the only thing we don't do is I don't do video because for me, when I'm listening to a podcast, I'm normally doing something. I'm driving or I'm cleaning out the guinea pig hutch or hoovering the house or doing something. So I don't do video. So it's not on YouTube, but it's on Spotify, Apple. I don't know if Pandora's still a thing. It was on there. I don't know if that's still on. But
Okay.
anywhere basically that you listen to podcasts, it should be
Be
on.
on there.
So
Okay.
yeah.
Okay, cool. So everybody in the audience, you got that information. It will also be in the description of the podcast. So if you did not catch it, I'll make sure those links and everything will be in the description. Now, my final question to you, Kate, is about advice. So what is one piece of advice you would give to someone who's at just beginning their hair loss journey, whether that's someone who's newly diagnosed with alopecia or starting chemotherapy, and they're noticed or they're just noticing for the first time that their hair is just thinning and they don't know what to do? What would you like for them to know?
I definitely do think it's really key to try and get a good understanding. So I know it can be really, really difficult. And that's one of the reasons why I'm always saying to everyone, go and see a trichologist, because by the time I often see people, it is that bit later down the road and it can be really, really heartbreaking. So, especially with things like chemotherapy, whether you choose to use a cold cap or not, that's not the issue. What breaks my heart is when people say, I wish I'd known about that. I wish I'd
Right.
had the choice. I wish I'd been able to have made an informed decision about the treatment that I'd had. I wish I'd gone and seen someone earlier or been able to. So if you're going to your GP and they're kind of fobbing you off, they're not listening to you, or you're not happy with the care that you're getting, unfortunately, especially in the UK, there is no provision on the NHS for hair loss. So you would have to go and see a trichologist privately.
Okay.
But I think the best thing is to make sure that you've got a diagnosis, you understand your condition, you've got an understanding of what's going on. Because then what you choose to do about it is going to be up to you. But at least you're not sat there 2 years later going, oh, I wish I'd known that. I wish I'd had that opportunity. I wish I'd been able to try this, but I didn't know. So what I always say to people, especially with hair loss, is don't put off seeking help thinking, oh, it'll probably just go away on its own. It probably won't.
It won't. It will get worse.
Yes.
Trust me, I was one of those
Yes.
people. So I
So
know.
don't ever think, oh, it's not that bad. I'm making a fuss about nothing. It's not, like I said earlier, it's not really about whether you're losing 20% of your hair or 70, 80% of your hair. It's how that affects you. And if it's affecting you, it's a problem. And
Yes.
if it's an issue, there is help for that. So don't think, oh, I'm being silly or I'm being vain or, well, there's people out there with going through worse things. Of course there is. But that doesn't mean that the way you're feeling is not valid and that it doesn't warrant help. So
Ex-
there is help available, and push to make sure that you get that knowledge and understanding, because then, like I say, what you choose to do with that is up to you. But then you're never going to be in that position where you're like, oh, I wish I'd known about this earlier, or I wish I'd done something earlier, and then I could have a lot more hair now.
Exactly. Yes. Thank you so much for that, Kate. And that was great advice, and I totally agree with everything you said. Also, thank you for the work you're doing in the UK and around the world, because you said you're an international speaker. So you are serving people around the world. Thank you, thank you, thank you. So for you guys who are in UK, so can you tell everybody before I continue, specifically in the UK, where are you located so that if anyone is in the area, they can reach out and, get in contact with you and potentially book an appointment?
Yeah, sure. So I'm in the southeast of the UK. I'm in Kent. So my clinic is in Kings Hill, which is near West Malling.
Okay.
Which you'll only know where that is if you know where that is. But it's in Kent, basically in the southeast of England. But I do Zoom consultations as well. So I can talk to people from wherever. Of course, it's nice to be able to come in clinic and have treatments and see me. But my door is always open.
Yes. Okay. Cool, cool, cool. All right. Well, this is going to wrap up this episode of the Bougie Body podcast. But before we leave, I have to tell you about the Bougie Body show. So for those of you who have been listening, the Bougie Body show is an extension of the podcast. It is on a streaming network called the Zandra TV Network, and it is season 1 of the Bougie Body show, where we have people like myself who have experienced different forms of hair loss and have just decided to just shave it off. And we are on there sharing real stories, giving advice, just really giving a one-to-one connection, so that for you all out there who are experiencing hair loss yourselves, you're not alone. You're going to hear some things that you can probably relate to. So make sure you go to the Zandra TV Network to check out that show. Also, we feature businesses that support people with hair loss. So whether that business was created based off the owner themselves having hair loss themselves and wanting to support the community, or it's just individuals who, like Kate, want to help in this area. So we have businesses on there that showcase what they do, talk about it, so that you could potentially go and reach out to them for services. So make sure you go. If you have Apple TV, Roku, or Amazon Fire, download the Zandra TV Network. Just search in your app store, you'll find it. And then you can go to the lifestyle section to find the Bougie Body show. And if you want to be a sponsor of the show and be featured, please reach out to me. You can visit my website to set up a call with me. That's limitlessmindsetcoach.com. All right. So that's all we have for you for this episode, and we will see you on the next one. Bye. Thank you for listening and watching the Bougie Body podcast. I appreciate you as an audience member. Now, make sure you go and check out the Bougie Body TV show. You can watch it from any device, any smart device. All you have to do is go to ZandraTV.com and you will be able to pull up my show. It is under the lifestyle section on the menu if you don't see it on the front page. So make sure you go check it out. And if you did not get it, it's ZandraTV.com. Go ahead and click on the link in my show notes if you want to make it easier for yourself, and it'll take you directly there. I will speak to you on the next episode of the Bougie Body podcast. Bye.
Thank you for watching the Bougie Baldy podcast. Don't forget to subscribe